How is HG diagnosed in dogs? If you have a furry friend who is suddenly vomiting and has bloody diarrhea, you might be wondering how veterinarians diagnose hemorrhagic gastroenteritis, often called HG. Let's break down the process step by step. First, diagnosing HG is not straightforward since there is no single test that can confirm it right away. Instead, veterinarians relying on a combination of clinical signs, the dog's medical history, and specific laboratory tests. The first thing a veterinarian will do is look for key symptoms. If your dog shows signs of severe vomiting and bloody diarrhea, that raises a red flag. Next, the veterinarian will measure the packed cell volume, which is the proportion of red blood cells in the blood. In dogs with HG, this number is usually elevated above 55 to 60%. This indicates dehydration and a concentration of red blood cells. While checking this, the veterinarian will also look at total protein levels, which may be normal or low in these cases. A complete blood count is another important test. This helps assess the overall health of your dog's blood cells. Additionally, biochemical blood analysis and urinalysis are performed to check for dehydration and any electrolyte imbalances. These tests give a clearer picture of your dog's condition. Fecal tests are also crucial. They help rule out other possible causes of similar symptoms, such as parasites or infections like parvovirus. If necessary, imaging tests like abdominal X-rays or ultrasounds may be conducted. These tests help to identify any foreign bodies, pancreatitis, or tumors that could be causing the issues. Since HG symptoms can overlap with other gastrointestinal diseases, the diagnosis often involves ruling out other conditions. In some cases, if the diagnosis remains unclear, more invasive procedures like intestinal biopsies might be needed, although this is rare. In practice, if a dog presents with sudden severe vomiting, bloody diarrhea, and an elevated packed cell volume with no signs of other diseases, it is typically diagnosed with HG. Quick diagnosis is essential because treatment usually involves aggressive intravenous fluid therapy to correct dehydration and prevent complications. Monitoring packed cell volume and electrolyte levels during treatment is vital to ensure a smooth recovery. So, if you notice these symptoms in your dog, don't hesitate to reach out to your veterinarian for a thorough examination. Early intervention can make a significant difference in your pet's health.